Help, I have done it again.
Good afternoon. I'm Dr. McConnell.
Hello. I'm Suzanne. This is my daughter, Elizabeth. What's wrong with her? She can't even walk.
Well, she could have Cooley's anemia, also known as beta thalassemia.
What's that?
It's a blood disorder, and it's when your blood doesn't produce hemoglobin, which carries oxygen to tissues of the body. Beta thalassemia is caused by mutations in the beta chain of the hemoglobin molecule. And without treatment, the spleen, liver, and heart become enlarged, and bones can become thin and brittle. A major problem is the buildup of iron in the heart and other organs, resulting in heart failure, and for some patients in their teens or early 20s.
She gonna be okay?
We'll have to zoom in for some confirmation of the situation.
Okay.
I am a red blood cell in Elizabeth's bloodstream. I do not create the correct amount of hemoglobin for her body. Hemoglobin is a protein in me, a red blood cell, that carries the oxygen to the tissues of the body. And I cannot create that amount for her to be normal. So Elizabeth contains Cooley's anemia. Now, 10% of and Greek people
No, wait, for real.
of their population contain blood cells like me that don't create enough hemoglobin. And 5% of South Asians also contain red blood cells like me.
Also have.
And 1.5% of Black Americans also contain red blood cells like me.
That means all those people have Cooley's anemia.
All those people have Cooley's anemia.
Red blood cells, like me, do not contain enough hemoglobin and are recessive and autosomal. This mutation is located on the 11th chromosome.
Some symptoms may include pale yellowish skin, dark orange urine, yellow eyes, extreme fatigue, abdominal/back pain, and dark black stools.
What are stools?
I'm sorry, but Elizabeth has Cooley's anemia. That means that you and your husband must have been carriers, and that meant that she had a 50-50 chance of getting it. It can be treated by regular blood transfusions, medications to decrease amount of iron in the body, surgical removal of the spleen, daily doses of folic acid, possible surgical removal of the gallbladder, no iron supplements, and bone marrow transplantation. It can be cured by a bone marrow transplant, and it's only possible for a small minority of patients who have a suitable bone marrow donor. Procedure, if it doesn't work, it can result in death.
No. Oh wait, I'm gonna die.
Da-na.
Is she gonna be okay? Hello, Steve. Guess what I just found out? Elizabeth has Cooley's! It's all our fault. We gave it to her. Bye. He's on his way.
you go down, when you go down, down.
Walk out the house with my swagger, hop in that whip, yo, I got places to go. People to see, time is precious, I look at my Cartier out of control.